So looking at the ultimate goal that we have with case management of managing this clinical trial as a case using BPM, the way we want to approach that is first by providing some value, by showing value, automating some specific processes, and then chaining those processes together to start to orchestrate end-to-end processes, and then eventually orchestrating all of these processes in concert to deliver case management. And that's what the diagram there is showing. We're pretty much about on the second iteration at this point if you want to know where we are in time. So given that that's the strategy, let's talk about some specific examples. This first example is about transparency, collaboration, and compliance. It's a general pattern that all clinical trial workers have to live with, and we want to make it better. And this is a specific. This specific topic is around something known as a submission regulatory document, 1572, financial disclosure and CV. This is a package of information that physicians need to provide in order to activate their site to do a trial with them. And again, thinking about where these physicians are, they're all around the world, and they have different local laws, different regulations, different forms they have to fill out before we can activate a site and work with them. And as you can imagine, in the past, this was all very manual. It was done through Excel, of course, email, etc. And we just didn't know where everything was. It all was a fire drill to find all the documents, to make sure we're compliant, and to get the sites activated so we can start to help patients. So what's the solution? Using Appian, we simply automated this process, which is in fact quite a simple process in the end when you see it, and put on top both a collaborative and mobile user interface, which really speaks to the way of working for these folks. That's, of course, very important, but what's also very important about this example is that it started to give metrics. So in the past, there was this sense of feeling out of control on the process. We don't know how fast it's running. We don't know where things are. Now that we've brought it under control with BPM and Appian, we see in real-time metrics. We know how fast it's going, and we can further calculate compliance factors to further improve the process. Conservative estimate is we've gone from a process that typically took 19 or 20 days down to 6 days. So that's a fantastic achievement, but it also sets the stage for continuous improvement. I get asked a lot, how does BPM fit with Lean and Six Sigma? And are they the same? Are they different? Do they compete? The answer is not simple. They're complementary. But what I often tell people, especially my Six Sigma colleagues, is that the use of BPM and Appian, if you can bring a process under control, if you can measure it, you're helping yourself during the measure phase, which if any of you have done a Six Sigma project, the measure phase can be quite arduous. So these are how things can really fit together nicely. You're starting to measure the process. The business is measuring the process. They can use that information to make a change to their process if they want, or just to run their business as they see fit. So that's a more qualitative benefit of this type of approach.